2019. Let's begin with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have a motion to adopt the, oops, sorry. I need a motion to adopt the agenda. I want to say Leon. Commissioner Drollet and Commissioner Romano.
Leon, press me in.
The agenda.
Yes, you can.
Did it come up?
Andres, no problem.
Move the votes forward. Passes 10-0. I need a motion to recommend to full board the grant agreement. What? Oh, I'm sorry, public participation. Is there anyone that would like to speak publicly? No? Nobody today? Calling once, calling twice? Agenda item 5, department recommendations. I need a motion to recommend to move to full board the grant agreement and budget amendment for the Michigan Department of Health and Human Services. Mr. Rodello, would you like to speak to that? I'm sorry, let's take the motion.
I'll take the motion.
By Commissioner Brown and Commissioner Ha.
Good afternoon. Thank you, Chair Lucido, and good afternoon, Board of Commissioner members. The department has received an increase in our grant funding from the Michigan Department of Health and Human Services of $212,080 as reflected in our Amendment 3 to our statewide contract. There are changes in 6 areas where we are increasing our grant revenue and expenditures by $202,080 and our general fund where we're putting some of the grant money by $10,000. So the 6 areas are outlined. They cover areas from our vector-borne surveillance work, public health emergency preparedness work, opioid emergency response work that we're doing in coordination with Operation RX, hepatitis A activities related to vaccine clinics and outreach, and also a health assessment work we're doing in our maternal and child health area. So at this point, we're asking for the approval of our revenues and expenses by the $212,080.
Okay, thank you. Commissioner Carabelli?
Thank you, Madam Chair. Thank you, sir. Is there an increase in any match funds for this?
There are no match funds required, so grant dollars.
Thank you.
Okay, are there any other speakers? Okay, let's vote.
Thank you.
Thank you. And it passes 12-0. Budget, or agenda item 5B, I need a motion to recommend to full board the budget amendment for Macomb Community Action. So moved by Commissioner Druze and supported by Commissioner Myjack. Oh, there he is. Mr. Cutler, would you like to speak? No?
Just say no.
Thank you. In your packet, you'll see that our LIHEAP program got an increase of $171,061 that we're going to use to weatherize homes in Macomb County. And again, we're just asking that you approve the budget increase. I'm happy to answer any questions.
Do we have any questions? Commissioner Druze?
Thank you. Gary, is any of this in working with AAA1B?
This is not. This is, program is through the Department of Energy and through the Michigan Department of Health and Human Services.
Okay, so
no AAA1B funds at all.
Okay. Okay, thank you, Madam Chair.
Okay. Vice Chair Carabelli?
Thank you, Madam Chair. Thank you. Couple quick questions. First of all, thank you for filling out the bid form. This information really was helpful for me when I went through this. I do have a question, though. Have you, it's not a trick question, though, have you in the past brought any of the contracts that you then sub out to vendors to perform the services. And with that said, do they hit our threshold? And then the third part of that is, you understand that our Macomb County preference bidding process for, getting a kick for being a Macomb County company. So,
Okay. Well, luckily, I have Division Director Cook in the audience who happens to be over top of that area, so Joe may be able to speak more on the details. We have multiple vendors that provide our energy home preservation work. So our staff goes out and does an initial assessment and determines what items are needed to get improved or fixed in the house, and then we put it into our software bank, and it determines which vendor would then get the business. Again, just simply if you need a lot of insulation, and that's the low bid on the insulation would be the one that would get that business. And then we have another inspector that goes back out and inspects it. The total dollar amounts that our vendors get during the year would, your threshold, I believe, is 35,000?
for certain things, I'm guessing, is that the blanket,
Oh,
Crystal?
Oh, I'm sorry, what?
Do you remember what our threshold is? Is it
30 or
35,000.
35,000 total?
So I would say between our, because we use the same vendors for both the Doe grant and the LIHEAP grant, that some of our vendors would exceed those dollar amounts.
Okay, and again, it's not a trick question, and I'm guessing the same thing, is that individually there's smaller amounts, but when you total it up, it could be some large dollars for one contractor. And I just, I'm asking the question because I don't ever remember years past anybody bringing those up. So with that said, please keep cognizant of when you guys are doing that, if these dollar amounts are getting over, that there is the process that they have to go for approval. So I just wanted to share that
Okay,
with you.
thank you.
Thank you, Madam Chair.
okay. Commissioner Ha?
Thank you, Madam Chair. Gary, could you explain who qualifies for these funds?
The exact thresholds at which the dollar amounts, the income levels are there, I do not know. I can get you that information, but it's going to be based on either median income or poverty level, but these are poverty programs that we are providing. So it's going to be the lower income people in the county that get it, and exactly what threshold, I don't know off the top of my head, but I'm happy to supply that information to you.
Thank you. Thank you, Madam Chair.
Commissioner Majek?
Yeah, I'm just curious, Gary, how many homes would you guys be able to fix? How many constituents would be affected by this increase, just out of curiosity?
This would be
It's a
What's-
tough
what's the
question,
fair
but
numbers?
this program is very interesting.
yeah, it's about 6,500 is our average. So-
6,500 people?
No, $6,500 a job. So
Per
this would
job.
be roughly 20 more houses that could get weatherized.
Give me a second here. How many is your office doing right now? What's the current budget then overall for this type of weatherization program?
So in your attachments,
Yep.
you'll see for this year.
Yep.
We have, so we're in
Gotcha.
Fund 302, so we're
Yep.
at just, between these two, we're at a.
500,000.
No. So on the, again, I don't know how your pages are set up, but
Right.
where it says one solution resolution, I can show you what the page looks like for me.
Oh, okay.
But we're looking at $1.2 million in programs for, between weatherization, within the weatherization program between LIHEAP and Doe.
I'm lost there. I don't know what's the title of that again? Oh, it's page 188.
It was an attachment that I had.
Okay, so I won't find it right now.
1.2 million
For weatherization?
for weatherization between Doe and LIHEAP.
Okay, so then how many does that come out to? I don't have my calculator, but if I do the math,
Just under 200,
200 homes?
just under.
Okay. And then how many years have you guys been doing this program for? This is an ongoing program, isn't it?
1977.
Wow. So that's a lot of homes, isn't it? So I mean,
One of the things is that once you get this weatherization, you can't get it again. So it's a one-time improvement.
right. See, Commissioner Romano says he loves grants, and we all do, but when you have a grant that's providing a great service like this and potentially saving constituents money on their homes, weatherizing them, I mean, that's a pretty good bang for the buck. So thank you very much.
Okay, thank you. Do we have any more speakers? No? Okay, I wanted to mention before we go to vote, our last vote had a technical glitch. It was actually 13-0, but we can vote on this one now.
Thank you.
The vote is 13-0, passes. We have a presentation. Oh, I'm sorry. 5C. Oh, yeah. I need a motion to recommend to full board the 2019 through 2023, the consolidated plan and the 2019 annual action plan. Mr. Cook, would you like to speak to this? And can I have a motion? From Commissioner Drolet and Carabelli.
Thank you,
Thank
Madam
you.
Chair. Good afternoon, Commissioners. Joe Cook, Division Director for Community Services with Macomb Community Action. As the Chair had stated, we have before you the Consolidated Plan and the Annual Action Plan. I've introduced you to Stephanie Burgess before, and I will reintroduce her today. She's our Program Manager for these programs, and she has a very brief presentation for you.
Thank you for being here today.
Thank you, and good afternoon. As a direct recipient of Federal Community Development Block Grant, CDBG, Home Investment Partnership, Home Funds, and Emergency Solution Grant Funds, I'll refer to those as ESG, the county must submit an annual action plan and have a current consolidated plan in order to receive its annual funding allocation. Presented for your approval is the 2019 Annual Action Plan and the 2019 to 2023 Consolidated Plan. To further explain the process behind the Consolidated Plan and the Annual Action Plan, I've prepared a short presentation. So what is the Consolidated Plan? It's required by the U.S. Department of Housing and Urban Development for grantees of CDBG home and ESG programs. The Consolidated Plan identifies housing and community development priorities for funding for CDBG home and ESG over a 5-year period. That's the term of this plan. They could be 3 to 5 years. The county has always elected to do a 5-year plan. The Consolidated Plan is then carried out through annual action plans, which provide concise summary of the actions and activities and the specific federal and non-federal resources that will be used each year to address the priority needs and specific goals identified in the Consolidated Plan. Grantees report on accomplishments towards progress on the Consolidated Plan in the Consolidated Annual Performance Evaluation Report, CAPER. So I did an illustration here to show you the process, the importance of having citizen participation and all of our partner participation in the Consolidated Plan. As you can see that the Consolidated Plan, everything that you want to do for the next 5 years has to be included in that Consolidated Plan. If you choose a project that has not been included in the Consolidated Plan, then you must do a substantial amendment. So you walk through the years 1 through 5. Each year will have its separate annual action plan and its corresponding CAPER. The Macomb Home Consortium, that's the name of the plan actually. What we do is we have the urban county, the CDBG entitlement communities, which is the 21 local units of government that do not receive their own CDBG funds. So the exceptions are Warren, Roseville, Sterling Heights, St. Clair Shores, and Clinton Township. They all receive their own CDBG funds, so they're not included in this plan. However, the Macomb Home Consortium does include Clinton Township, Sterling Heights, and Roseville. As the lead for the Macomb Home Consortium, the Macomb County drafts the Consolidated Plan and submits that to HUD. We then share Consolidated Plan goals and priorities with the other members of the Macomb Home Consortium. So our funding sources are CDBG, home, and ESG. The slide will show you it gives you an objective for each one, the service area, and then the funding limitations. So CDBG, that's used for a range of public improvement projects and services designed to benefit low to moderate income persons, prevent or eliminate blight, or address an urgent need, which is a very rare goal or objective under the plan. Our service area, again, is the 21 communities that do not receive their own CDBG funds. And the limitations are 15% max for public services and 20% max for admin. Under home, those are used for housing projects. That is the urban county of Macomb, Roseville, Sterling Heights, and Clinton Township. 10% admin max and 15% for community housing development organizations that do housing projects. Currently, we have 2 CHODOs, Community Housing Network and Macomb Habitat for Humanity. And then our Emergency Solutions Grant, the ESG, those are specifically for homeless persons. It serves all of Macomb County. We are the only recipient of ESG funds in Macomb County, so we serve all Macomb County residents. 7.5 for admin, and then street outreach in emergency shelters cannot exceed 60%. I went through and did a couple slides. There's a question about funding over the last few years. So for 2014 through 18, which is the term of the last consolidated plan, we had a low of in 2014 and then a high in 2018 for the CDBG funds, the high being 1.8 million. For the home funds, we had a low in 2015 with 1.1 million, and then last year it did spike to almost 1.8 million. These ESG funds are considerably less. We started receiving funds in 2014, 135,000, and then the max was in 2017 of 155,000. So the consolidated plan required components, we have to do an executive summary. We have consultation and citizen participation. We do housing and homeless needs assessment, a housing market analysis, a strategic plan, and then we have a 1-year plan. Each member of the Macomb Home Consortium is responsible for drafting its own annual action plan. The consolidated plan process, the steps for that include assessing accomplishments towards meeting the 2014 to 2018 goals, engaging stakeholders. We had a very large effort in trying to get public participation in this process. It's very important to have authentic public engagement. We posted on Facebook, we did mailings, direct calls. We went out to groups. We tried to expand our outreach as much as possible because the important part is they have to be, any proposed project that you want to do over the next 5 years, it needs to be considered in that consolidated plan. So we really need input. We then analyze data for current housing needs, establish goals and priorities. We draft the consolidated plan. It's out for 30-day public comment period right now through May 15th. We submit the plan to approval to the Board of Commissioners, and then it's then submitted to HUD for final approval. So through our citizen participation and through our research, the plans that are the goals included in this plan make available appropriate housing, improve public facilities and infrastructure, address the needs of homeless and at-risk families, provide and expand human services, foster economic development, aid in the prevention of slums and blight, and expand comprehensive planning, management, and capacity. I won't go through each one of these needs, but we did have to rank high priority needs and low priority needs. All of these are included in the plan. We did confirm with each one of the communities that each of these needs would address their own specific needs. We have high priority needs. Housing is a very high priority needs. Affordable housing units in Macomb County, there's not enough for people that are 50% area median income, and especially not 30% area median income. They have significantly high cost burdens related to housing. And then lower priority needs, while still important, you could go through that list. The top being accessibility, barrier-free improvements. With Garang and Macomb, it's going to be especially important to make sure that all of our public facilities are accessible. So the notes that I wanted to include, the HUD allocations were not available at the time that the plans were posted for public comment. The funding for the plans are estimates based on actual 2018 CDBG home and ESG allocations. The plan did include contingency language regarding estimated and actual funding allocations. This is allowed by HUD. This is how we can get through the process because the federal government has been later and later and later in announcing the allocations. We still are held to certain time constraints. So we are able to post a plan with estimates as long as we include contingency language. And of course, due to limited funding, it's not possible to address every goal during each program year. It's the intention of the Macomb Home Consortium members to fund an activity under each goal at least once during the life of the consolidated plan. So since you have, since the plan was submitted for your approval, HUD did announce the 2019 actual allocations. For 2019, CDBG was $1,787,133, which is a difference less of $75,874. Home also went down, but still it's funded significantly compared to what has been done in the past. The shortage, again, $203,467. And ESG actually went up. We have $158,080. So that went up by $3,640. For the contingency provision for CDBG, the decrease in funding will be applied to the Housing Rehabilitation Program. And for home and ESG, the budgets for all of the activities will be proportionately increased or decreased from the estimated funding to the levels to match the actual allocation. That is the end of my presentation. I'm open to any discussion or questions you may have.
Thank you. I'm wondering, you just mentioned the shortages.
Mm-hmm.
So some of the programs are going to be decreased or cut depending on who was paying or how much the decrease was?
Mm-hmm. Right, they'll be proportionately, for CDBG, it's going all to the Housing Rehabilitation Program.
Okay.
With that program, though, we do get funding through the year program income. As residents pay off their housing rehabilitation loans, it goes back into the program to fund additional work. Also, whenever a project comes up short, say a community applied for $200,000 and the project comes up at $190,000, any residual funds then go into the housing rehabilitation program. So that program at this point is very well funded, the housing rehabilitation, so it's not going to have too much of an impact on that program. Fortunately, with the ESG, that did go up, so we'll be able to provide additional homeless services. Housing home, that program has been volatile for quite some time, so I'm just glad to see a $1.5 million allocation to that program and that it's continuing.
Okay. And is the money spread by population across all of the places that you mentioned that they touch, or is it more specifically in certain areas?
What we do for our CDBG program for 2019, we take 25% of the funds and set that aside for housing rehabilitation. 20% is then set aside for admin. The remainder of the CDBG funding is allocated to communities based on the Urban County Shares Report that was issued by HUD. Mm-hmm. So we allocate those dollars, and then the community, we believe in local control, so we allow the communities to select projects that best serve their needs in their community based on their allocations. And then they also use some of those funds to allocate dollars to nonprofits that also serve their communities.
Okay, great, thank you. Vice Chair Carabelli?
Thank you, Madam Chair. Thank you for the presentation.
You're welcome.
Very well put together, and I appreciate that. I do have a couple of questions for you, though. If you can go to your slide, if you can pull it back up, because our slides are cut off, so I apologize. It's your 2019-2023 Consolidation Plan priorities, please.
Sure. Right there? The high priority needs, low priority needs? Yes.
You know, as I go through this, and this is not just germane to yourself, I look at duplication of services that government does. So, for example, I look at energy, shelters and transitional housing. No, not that one. Bear with me. I apologize. Public improvements, shelters. There was another one on there that talked about energy. Where was that at? Maybe it was earlier. Anyways.
It's in the low priority.
In the low priority. Mm-hmm. Okay. My question is that, so food banks and youth programs and all these different things, how is this coordinated with the rest of the county's pots of money that they're doing certain things with? How are these dollars coordinated with
No.
The food bank, for example. You know, we talk about, up here at the board, we talk about Meals on Wheels. We talk about, you know, the different food programs we have at, what's the elementary school? I think it was in Mars District we went to. They provide breakfast for the young children. I forgot the name of it. Anybody can help me out. All these different programs that we have. So is this a separate silo where the money you're getting is separately and it's not enhancing the programs that we have and expanding, or is it completely separate?
Well, specifically for food banks, those dollars are not used by Macomb County staff. That's Samaritan House is one of the food banks that we fund. That's up in Washington, Shelby Township area.
Okay.
So we have nonprofits that come in. So the high priority needs and the low priority needs here are not just for county services. These are for nonprofits that could come in and ask for money under these grants.
Okay, so they can not only come into the municipalities that receive the funds and apply for their portion of the CDBG funds, but they can also come directly to the county. So when I went back and I looked at health and expand health, human services, domestic violence, senior citizens, single-parent household, those programs, is that like Care House you're giving money to? Okay, how are you determining which grants you are awarding funds to and which ones you're not awarding funds to?
Actually, the communities select the nonprofits that
So
they would
the
like to
county-
fund. What we do is we get all the applications. We do an RFP and ask the nonprofits to submit applications. And what they do on their application then is indicate which community they were requesting money from, because not every nonprofit that comes to us serves every community. So what we do is we go through the applications, make sure, one, that it is an eligible program, and that everything's in line and they have the capacity to be able to use CDBG funds. And then we write up a summary that is submitted to all the communities that receive the CDBG funding. And this is the community's allocation to those nonprofits. It's not coming from, say, the county, it's the communities. That's where the local control comes in, is that if the county has some other funding that they give to one of, say, Turning Point or whatever, that's the county giving money to Turning Point. This would be, say, Shelby Township giving money to Turning Point. It's where they're directing their funds for their CDBG allocations. We don't give out separate allocations.
Okay, so the
Yeah.
county doesn't take any of these funds directly to any organization. It is a request of the local municipalities to come to the county, show that they did their due diligence, and go forward. Is that how it is required, or is that just how we do it?
That's how we do it. The
Okay.
communities like to have the choice over the nonprofits, and we encourage that because they know they know the needs of their community more than we
Right.
do.
But there's no rule that says you have to give it to any nonprofits
No,
first?
you don't have to even go to the public. You don't have to fund any public services if you don't want to.
Correct. I just wanted
yeah.
to get clarification. Okay, thank you.
Yep, you're welcome.
Thank you, Madam Chair.
Commissioner Kleinfeld?
Thank you. First of all, piggybacking on that. So it's on your page that has all the numbers, the first one. So you've got all these cities and townships listed, and then after that, you've got the list of private nonprofits. And then 3 Macomb County. So that is all of the nonprofits that received money from each community, and it's collectively added up. So if Roseville gave 4, if Roseville gave and East Point gave, it's all calculated in this group of nonprofits?
Yes, it is. Yes, it is. There is a separate sheet, and I probably should have included that in with this, but it would show which each community provided for each one of those nonprofits. So I'm just going to give an example. So our Care House, for example, could be funded by 8 different communities, or up to even 21. What we do then is their agreement that they get is one agreement, though, that outlines how many people we expect them to serve from each one of those communities. And they set a rate that it costs them to be able to serve a person, or if it's a food pantry, they say how much per person, weight on food. So yes, that is a combined agreement right there. It's not coming from like the county picking which nonprofit. It's the communities, and then we combine for one agreement.
Okay, so when I served on council, we would get a list of nonprofits, and they'd come and, say, please give us money, and we would go through that list. What you're saying is how you ended up on that list to begin with is you send out an RFP. Because I never knew how the original list was compiled, I just knew we had a list to choose from. So if there are charities that are, how do charities get on your RFP list? I'm just thinking there've got to be, it's always the same ones over and over and over again, and I can't believe, I know of one in particular in East Point, housing single pregnant teens that might be interested in applying, and I'm wondering if they're getting the RFP.
We publish the RFP in the Macomb Daily. Then we also send it out to any of the nonprofits that have applied to our program in, say, the last 3 years. Just send out an email to them too, because you don't know if they're going to be able, if they're reading the paper, we want to reach it out, do some outreach as much as possible. We also announce it at the Continuum of Care, where there's a lot of nonprofits. One thing you're going to find with the CDBG funds, as far as, because we really tried to get more nonprofits, because that has been an issue in the past for why are we funding the same nonprofits over and over. This money is extremely difficult to work with. And a lot of the nonprofits don't want to change their process just for, say, $2,000, $3,000. They have an intake process that works for them. They don't want to have to ask different questions or track different data. So if you have a nonprofit that has got a $100,000 budget and say they're going to get $2,000 from us and they're going to have to change their whole process just to accommodate us, we have had nonprofits that have applied and then not taken the money.
Okay, so if a nonprofit just wanted to get on your list to receive the RFP, I think it's easy to miss the thing in the Macomb Daily.
Sure.
How would they do that?
Call our office, we maintain that list, and as soon as the RFP is ready, we send it out to everybody who has either applied in the past or has contacted us in the last year.
Okay.
And we do hold sessions to be able to, before they apply, because we found one of the years, we had a couple nonprofits apply, and then after they got the agreement, found it was too difficult. The shame in that is that those nonprofit dollars could have gone to another nonprofit or food pantry or
Right.
something like that. So the money sits.
When
So
you
we
send out, you don't give the information on, before they apply?
Yes, we do. We do, but we sit with them now before they even submit applications to let them know exactly what the full process is and what sort of reporting you're going to have, what are the income verifications. So we try the outreach, but to understand this money is extremely difficult to work with, and a lot of the smaller nonprofits, it doesn't fit into their administration model.
Okay, so my last question is with regard to the next page, the Home Consortium member allocations. Now, if I understood you correctly, you said you've already got to be in the 5-year plan to be eligible. This is 2019. So if we're approving a plan that's 5 years, if you're not already in that plan, you won't be eligible for the next 5 years. Is that what you were saying?
No, I must have misspoke. What it is
You
is
might
that
not
you're-
have,
No,
I
it's
may have
very
misheard.
complicated. So no, we need to make sure that the goals and objectives, and then the high priority needs and the low priority needs, that if you come to me with a project in, say, 2022, that it's included in here. So that's why the goals and objectives and the priority needs are quite broad, because if you
Okay.
came to me and said, I want to do rental housing for single moms, then we don't have it right now, but it could be covered under the plan.
And then I think you said that during the 5-year period, you try to hit on every community with a project, or we have the map of the communities that are participants, and then we have the list of those that'll be getting money this year. Did you say that you try to hit on every community that's a participant during that 5-year period?
No, we try and hit one of the goals, each of the goals at least once during the 5-year plan.
So even if there's, looks like 9, 10, 11, like 15, 17 communities that are part of that, it could be the same group of communities that get the money over and over again? Because it looks like this year, there's 3 communities that will be receiving these funds, right?
Oh, are you talking home? You're looking at the home funds right now?
Yes.
Okay. The home funds, remember, Macomb County is the 21 communities. And then, to be part of the Macomb Home Consortium, Sterling Heights, Clinton Township, and Roseville, because they could not get their own home allocation, joined the county. So then we get one home allocation. And then those funds are distributed, and that's a ratio that HUD gives us, the percentage that we divide the home funds to.
So these other communities that are, because there's other communities
Yeah.
on the map, they're just not in here because they're already set up to receive their money, or?
They're included in the 21 communities for Macomb County. So, right, so that's, you're not going to see New Baltimore and, Romeo, Richmond, all that, because they're included in the Macomb County line. So it's actually
Oh, the
24
bottom line,
communities. Yeah,
okay.
it's actually
Got
24
it.
communities.
Thank you, Chair.
Thank you. Commissioner Romano?
Thank you, Chair. Hi, Steph.
Hello.
For those that don't know, I had the pleasure of serving with Steph while I was on city council for almost 20 years. And her husband is fortunate enough to have her as a wife, and he's a retired Sterling Heights police officer. And how is Aaron doing?
He's fantastic.
Okay. And Joseph, do you appreciate, I served with Mr. Cook also in Sterling Heights on a commission. And you're lucky to have this young lady. We're going to ask you all these questions. That's why you brought her up there. Okay, so my question to you, Steph, is the communities that are excluded because they have their own CDBG funds, example, the ones were excluded, Warren, Roseville, Sterling Heights, St. Clair Shores, and wherever else. Do they get any additional funds from you, or just the funds that they get for their municipalities, and can they use it strictly in their municipality?
They get their CDBG funds on their own, and they use that in their own communities. What they get from being part of the Macomb Home Consortium is the home dollars. So that's the only difference. They joined the Home Consortium just to be able to access those affordable housing dollars.
So do they get it, and I think somebody asked that question, in proportion to the population, like would Sterling Heights get more because they joined the consortium? Would they get more money or less money, even though they get their CDBG money direct?
They get their CDBG money direct. They would not get any home dollars if they didn't join the Home Consortium.
But they have
So-
joined.
Yep, they joined, and so the percentage that they get here, if you look at the spreadsheet for the home funds, they get 19% of the entire grant that comes to Macomb County. And they're able to use those dollars for projects within either Sterling Heights or within the Macomb Home Consortium. Because the one thing with home dollars is it requires match, and not everyone could come up with those match dollars. So sometimes it's, I'm going to use my money in a different project that may not be in my community because it's going to be able to get me home match dollars that I could use on another project.
Okay, and the last question I have for you, you mentioned something about the high priority, low priority. One of them was a down payment assistant program, which interests me, being a real estate broker. How does that work out? Is that repayable to you? I mean, is there a certain amount that you give? Can you go a little bit into that?
We don't have one now. We don't have a program, but that's why it's a high priority need moving forward. We need to look into different programs and how we can provide down payment assistance, because as you know, being in real estate, housing is only going up and up and up, and they're pricing out people who are under 50% of the area median income. So we need to look at ways to provide down payment assistance, and that's why it's a high priority need right now, and we hope to be able to address that during the 5 years. So,
So will that be repayable, do you know, or is that to be determined?
to be determined.
Okay, that's all I have. Thank you, Chair. Thanks, Steph.
Thank you. Commissioner Brown?
Thank you. Certain areas of, I just happened to hear an ad today, HUD was putting out, talking about housing and home discrimination in housing. Is there any discrimination, any reports of discrimination coming to our office about issues of discriminatory housing practices?
I have not received any. We do provide funding to the Fair Housing Center of Metropolitan Detroit, and they do provide a report to us at the end of the year. So once I have that report, I'd be happy to share that with you, but I have not received any directly, into our office.
I'd be curious.
I'd be happy to share that.
We provide a great service to many of the communities for the county, especially the townships, and providing that CBG service to allocate and give them the money. They've come to think of it as a gift, and that but they don't really fully appreciate that that's something that our staff does a good job, spends a lot of hours on, to provide them the ability to make them the hero when it comes out passing out gifts at their board meeting, because they have nowhere else to spend the money. So they all
all the nonprofits line up at the board meeting and come and say, I want this for this purpose. And sometimes housing's one of those issues. And I've been around the program a long time and through this board, and you know, you said that ups and downs is probably an understatement for some of the programs, but they've always been there, and they're always taking care of somebody in need. And that's ultimately the goal. How you get there is a problem sometimes, but, you know, we're doing it. And so I want to thank you and all the staff there and everyone else in your organization for doing a good job, because you are providing needed service, and, you know, doing what you can with a little bit of money doesn't hurt, so I appreciate it. Thank you.
Thank you.
Thank you. Commissioner Kraft?
Thank you, Madam Chair. Okay, help me out. Money comes from above, filters down to the three categories, CDBG, home, and ESG, correct?
Yes.
And then from there, it goes to the locals, correct? Is that the process?
Not for all three.
Okay,
So for the first CDBG, yes, we divided out, as I said, 25% for rehab, 20% for admin, and then we funnel the remaining to the communities. They pick projects and services based on their local needs.
okay. Time out real quick before you move on to the next one. When it goes, after you take off the percentages from the top and the rest goes to the local communities, can they then determine percentage-wise what they use for what, or do they still have that 15% max for public services?
The way it works is the entire grant is 15%.
Okay.
The way the calculation is, this last year, I was able to allow them to use up to 25% of their grant for public services.
Okay.
It's in the math, but it does work.
Gotcha. I had some
So,
concerns from
yeah.
one of my communities, so I'm
Yeah.
trying to figure out the math so I can help them with the math. So I may
Right.
just send them to you.
Yeah, that's fine.
But time back in, so
Okay.
back to the.
For the home dollars, we do administer all the home. As you can see, 1.5 million isn't a lot to address our housing needs. There's no way to allocate those in a small enough amount to each of the communities to be able to do that. And home is extremely complex, and especially because there's long-term. If the grant goes away tomorrow, you have got 20 years' worth of reporting and compliance to still follow, even if
Okay.
the grant goes away. So it is complex, the match is there, and then really the amount of money that's needed even to complete one house, we administer that whole program through.
Okay.
Now, the communities, Sterling Heights, Roseville, and Clinton Township, they do select their own projects.
Okay.
We have taken over, not taken over, but we assist them with their housing rehabilitation programs when it's using with home dollars, because it is way different than using CDBG funds with rehab, believe it or not. That's how the regs work.
Okay.
Now, for ESG, our office administers those completely. We have gone out for RFPs for homelessness prevention programs, rapid rehousing. There's a homeless management information system, that's the dollars that we fund. And then shelter operations, we go out for an RFP because, of course, the county is not a homeless shelter. So we have multiple agreements, believe it or not, for $155,000. And that, again, is another complicated program. So we administer those through our office.
Okay, and then one more quick question with the CDBG funds. You have all these priorities and plans and things like that. Do you go through every year and then just percentage-wise attack those, or do you just look at everything as is and attack it that way? You know, is it, 15% for senior services, 10% for rental housing? How do you determine who gets what?
Well, the CDBG, remember, that's local control.
Okay, so they.
So they're the communities are the ones that look at that. They have a wide range, because I have 21 communities and trying to fit all their
Sure.
needs into these high and low priority needs.
Okay.
So they select those. So really, there isn't a way to be able to do that at this point. If
Okay.
we ever look at a different way to allocate money or award money, then that may be put into consideration, especially with how much more difficult it is to find eligible census tracts and block groups.
Sure, okay.
Yeah.
Thank you very much. Thank you, Madam Chair.
You're welcome.
Thank you. Commissioner Ha?
Thank you, Madam Chair. In Roseville, what we had done is we held advertising in the East Sider and the Macomb.
Can you speak into that microphone? Thank you.
Only if it makes you happy, Joe.
I hear what you guys do.
We had, yeah, we had advertised in the East Sider, which goes to all the residents, and in the Macomb Daily twice. Then we held a public hearing, and then the council decided the distribution of the funding. Then we held another public hearing for which all the applicants could show. We finished that on a Tuesday. On Wednesday, there was 2 charities that came in and indicated they didn't know about the process. So we thought we had, and we advertised it on our local television network. So it, as much and as hard as you try to make everybody aware, there's somebody going to get missed. And then the priorities that we looked at is internally within the community, what were our greatest needs? So I just wanted to explain that, but I do have one question for you. This very complicated chart that Phil was trying to show me how to read here. It's 2019 ESG budget. There's a line item here that says homelessness prevention 50K. Could you explain homelessness prevention?
Yes. Homelessness prevention, that is to keep persons who are at imminent risk of losing their current housing in their housing. I believe they have to earn no more than 30% of the area median income, and they have to meet HUD's definition of homeless, at risk of being homeless, because HUD has different definitions for homeless, whether you're getting the rapid rehousing or if you're getting homelessness prevention. So all of these programs that you're looking at are either to keep people from losing their current housing, which would be the homelessness prevention, or say the rapid rehousing, they are currently homeless, they meet the definition, HUD's definition of homeless, and they have an income that is below 30% of the area median income.
So within the homelessness prevention category, what exactly gets done to keep somebody in their home?
Well, if they have rent issues, we can look at that. If we have to relocate them, say that they're being evicted and that the current landlord won't keep them in that housing, we can try and locate additional housing for them. If there's credit repair, I believe that we're able to do that also. I don't have all the categories in front of me, and I have a very good staff member who does this program. She's phenomenal.
Okay.
I'd love to bring her sometime because she's fantastic. But she would be able to explain all of the eligible uses of homelessness prevention. My nutshell definition is just keeping people who are below 30% AMI from becoming homeless.
Thank you.
You're welcome.
Thank you, Madam Chair.
Vice Chair Carabelli, second round.
Thank you, Madam Chair. I got a question for you. I know how you're breaking out it. I know how it's being spent. And if I'm not mistaken, it's a maximum of dollars that can be given out to charities, up to. But you can give it to, you can say next year we're giving 0 out to charities. That's a call of the county. My question for you is this. Can the county physically expend any of these funds by law?
Sure.
Instead of us,
I guess
for county programs? Like,
Oh, sure. Yeah, we do. Not all public service dollars go through, the 15% maximum is for public services, whether you use a private nonprofit or a county public service. And we
Okay.
actually do that through the CHORE program.
Let me give you an example. Public improvements, public facilities, transportation services, senior and youth facilities and services, public services. Reason I bring that up, for those commissioners that didn't go through your entire package, there's a letter at the end of the Martha T. Berry presentation that you're being requested $1.3 million a year out of the general fund to compensate for the repairs and the running of the facility. And if I'm not mistaken, the way I'm understanding it, the county could actually, out of these funds, allocate some funds towards the seniors and the Martha T. Berry, if so chose by, I believe, the executive office, who gives you direction on how to
I put
approve
an
it.
asterisk by that because if anyone calls me and says is something eligible, I never give a yes or no until I see the entire project. So
I understand. So what
So
I'd
in
like to
theory,
introduce, what I'd like
you
to
know,
do is
yeah.
introduce the gentleman behind you.
Sure.
And have him set an appointment up to meet with you tomorrow maybe, and figure out if there's possibilities in upcoming years to offset the $1.3 million that's being requested, because it falls in line with this. And I think that's an opportunity for you to at least explore and report back to the board after you have a meeting. Thank you. Thank you.
For sure.
Okay, thank you. Last call for speakers? Okay, let's take our vote.
Thank you very much.
Thank you. Very good presentation. Thanks. And it passes 13-0. Agenda item 6, our presentation. I need a motion to receive and file from Commissioner Romano and Commissioner Kleinfeld, the Martha T. Berry Monthly Report. Thank you for being here.
Madam Chair,
Yes.
just a question. Your call, but if you would like to skip the presentation that we all have and have them get into the letter that was presented, I think that's probably the meat and potatoes that's under receive and file that should be discussed today.
Sure. That would be great. We can read over the presentation on our own and instead go into the letter.
I think the request of $1.3 million a year is something that the commissioners probably would like to hear a little bit more about.
Okay. Yes, thank you.
Anybody disagree?
Anyone disagree?
Was there anything in that report that's notable, that's out of the ordinary? Anything out of spec?
Financially.
No, there are some things that explain, what I'm looking for, in the presentation.
Okay,
That it's not, I'm not looking for a subsidy grant or debt forgiveness in this, but I want to show what we're asking. I appreciate the creativity, thank you very much, in looking for that, but if I could just look at the end of this and
Okay.
kind of explain that at the end of the presentation, then go right into that, we could do it together, if that's okay, Madam Chair?
Sure.
Is that okay, Commissioner Carabelli?
It's okay with me. Okay.
Any other motions? I'm good to go?
We have our
then?
motion.
good.
Thank you.
Very good, all
Our
right.
blessing.
So, thank you. It's important to note that I'm not asking for a subsidy grant or debt forgiveness in this. We recognize that that the OPEB is a responsibility for Martha T. Berry. There's some things that we're looking at because we don't quite understand where the numbers come from. For example, we're less than 2.5% of active souls, right now as compared to the rest of the county in OPEB. But we have about over 8% of the total debt. So we're going to look some more into that. I'm assuming goodwill on that, and there's a reason for it. I just don't know it. It doesn't have the clarity of the adjustments that happen in pension, so I'm comfortable having data on that. But I'm looking at that for one thing. But I do know that we owe a debt
Point
to
of
that.
information, I think you need to be a little bit more clearer on that, because I don't think everybody understood what you said. So go back and say the percentages that you're thinking that you should be responsible for and what you're actually paying. And I think that'd be opening up some commissioners' eyes.
It'd be nice if we read the letter. I didn't
Oh,
see
sure.
the letter.
Well, here's the numbers right here. It's actually in the OPEB slide. Right now, MTP active employees as of 2016 were 46, and that's changed several less than that over the last couple of years. But the active county and sheriff employees are 1,630, so we're 2.74% of current actives, if you will. But the $20 million represents 7.69% of the total $260 million funded in that 2015 bond. And I don't understand why those numbers don't correlate. So, but I'm assuming goodwill on that, and I just need to look at that some more. Right now, I just wanted to present that as
Excuse me. Can we?
Well, sure, let him, who's going to talk here?
Well, you don't want to know who he's talked to?
I do. I'm just saying, I hear a lot of crosstalk here on what's going on. I mean,
So the question would be, who have you reached out for that information, may I ask?
this information we received from the Human Resource Department.
Okay, and did you CC the board when you asked for that?
No, I did not. Is that something that I should do, or?
I would strongly suggest it.
It would be good to have that information in the future. Thank you.
I'd be happy to. It's one of those things that is kind of clunky, and I apologize to the commission. As I'm learning this, I'll just copy. Should I copy everybody or just copy?
The board office.
The board office. I'll get it to Patty and.
No. No, we're not faulting you. Yeah.
Thank you. No. Our total actives, it looks like, we're closer to that 8%, but I don't understand why those numbers don't correlate. So we're going to be looking at that as a rule. It makes sense just for me to understand it better so that I can serve you better.
I know that I'm doing a poor job of helping the commissioners understand OPEB as well, because I'm learning it as I'm doing this. So please forgive the clunky nature of the
No,
presentation.
we're learning it as well.
So, again, it's important that, you know, I do recognize that there's going to be a temporary hit to the county of 1.3 a year for a few years. But I'm not asking for forgiveness. I believe that we can really work on it well. I'll skip the expenses side of it, but this is what I'm looking at right here. And if you can take a look at OPEB, we've been paying it all along at 1.3. It is certainly the largest expense that we've had over the last 4 years. We're projected to put another 1.3 this year. And so what I'm asking is, if I do actually pay the 2019, that'll leave me about $800,000, $800 to $1 million in my checking account, which is not enough for a full month at Martha T. Berry. So I'll need to rebuild cash during that time. Normally, just like the county has a percentage, I'd like to have about $2 million, and that's a safe number for me for when Medicare and Medicaid goes. So what I'm asking for is, if we pay this year and then say defer 2020, 2021, and 22 across the top there, once the building use is done, then OPEB kicks in 2023 and on until it's paid off. So looking at those 3 payments, taking them from those years and just tacking it on to the end. You see, here's something that I think is important for you to note too, and I think my board alluded to it a little bit. You take a look at the building use and the repairs and construction. I asked for this purpose, Jeff Ostermeyer is with Plant Moran. I asked him to pull out any equipment that we have purchased, so I didn't want there to be a false sense of what capital items are. This is what directly is getting put on the building, either in infrastructure or improvements. We're looking at finishing up construction this year, but I'll need construction over the next few years of around $400,000, along with the repairs of $825. And the reason I point that out is, if you have rental property, you recognize that if you do, and the water heater goes out and they replace it, you just back charge, you know, that in the rent, right? That doesn't happen with me. I'm paying and I'm repairing everything right now. And the facility's been doing that since 2009. And frankly, just again, to be frank, they've not done it well because you can't do both. So it's difficult to do both. I had the good fortune of having that certified public expenditure money come in that helped me catch up on some of that this year. And now we're pretty close to it. So that's the ask on that, is that you would consider that. Some individuals said, you know, did you pull the trigger too quickly on doing the construction? I think it's a good question to ask and answer. This actually came out a couple of years ago. This is new regulation that says we need to create a more home-like environment that includes eliminating meal service using trays, which is our entire institutional service model, with times, not giving people time of when they want to eat, but telling them when they have to eat. That's specific to the home-like environment. That's a regulation that we have and that we're fixing with this addition and renovation. So it is the right time, because I believe there was no better time. And I was balancing, on behalf of the county, the tension between running out of money, getting a building that needed to be repaired, the really important things repaired, and still meeting our debt obligations. So that kind of ties in with what the letter was asking. Again, I'm not asking for debt forgiveness or for a subsidy, although I appreciate the kindness in looking at it creatively, Commissioner Carabelli. I do believe that we can meet our obligations without a long-term loss to the community. I'm just asking for some help on that. I also, just like I didn't think about CCing you when I asked for that information, I don't actually know how this works. I'm asking you, I'm also asking the county executive office for the same thing. So I'll need some help understanding how to navigate that when the time comes to.
Thank you. We have some questions? Commissioner Kleinfeld?
Thank you. Okay, looking at the letter, it talks about the 300 million in bonds, and you said 260. I thought it was closer to 3, but it's not really that important. You said money was given up front, the approximately 9 million. And it said it was used to partially begin paying OPEB and to pay for badly needed repairs and improvements. When we bonded for that, that wasn't an option what you could use it for. And even if it got moved out of our system over to your system, why on earth did it become an option that you could spend it in any other way other than for that purpose?
For what purpose would that be?
For OPEB, it's saying, unless I misunderstand this, am I misunderstanding? All right, Jim's telling me I'm misunderstanding. Okay, so then I'll skip that, and the other one might be a misunderstanding too. You talk about the approximately 9 million, and then in the next paragraph, you talk about payments of about 5 million have occurred. I'm assuming I'm still misunderstanding, so I'm gonna let other people talk and maybe I will get a clear picture instead of the picture that I have. Thank you.
Chair Smith, care to, yeah, clear any of it up?
I am not clearing any of that up. We'll let Kevin and Commissioner Carabelli work on that.
Well, I can speak out of abject ignorance, Commissioner Kleinfeld, because when I got there, I wasn't even aware that OPEB was there. And CPE money, the purpose of certified public expenditure money is to be used for the facility. Also, there was no agreement. I mean, there's no signature by any board member of being part of the bond. So I was going into it blind only with past experience. I also do know that money that comes in from the federal government has to be used for that same purpose, for that entity. So certified public expenditure says you expended money for Martha, in this case, Martha T. Berry, over and above what your normal costs were, so we're going to give you just a little bit of it back. And that money is to be used for, directly for Martha T. Berry. Now, I can use it to pay partially the OPEB back, and if we paid for it all back, we'd still have the same conversation because I'd still owe $17 million, but we'd have a busted up building. So you know.
I'm just going to let him explain it to me because that paragraph only talks about OPEB, so I'm not understanding this other thing we were talking about that has to be on the building. I was just looking at that one paragraph, and maybe that's the problem.
The bonding was separate. The OPEB bonding, 300 million was separate from the money he's.
Okay, it's just all in the same paragraph, so thank you.
Okay. So I just want to kind of put this in, a little more clarity for everybody. You rent the building from us, so you pay the rent, and then we found out that the mechanicals, the underground, everything was obviously in dire need of being repaired. And instead of the landlord or the owner paying for that, you, the renter, has been paying for upgrades to our building, right? So that I'm just pointing it out. So you're putting your money into our facility to upgrade our facility, so that if we pulled the rug out from under you any time, our facility would be worth more, right? So I kind of want to point out that that's an unusual, unless it's in an agreement. I mean, obviously you can agree to anything. So, but that's, you're spending an awful lot of money on, and quite a few things that weren't even anticipated when you started digging and going underground, and we've had several conversations on that. What you're asking for is to hold off on a few years of those payments, but not to be forgiven in the payments, so those payments would just extend longer instead of being paid off at a certain date, right? Okay.
That is correct.
And I just want to put this in as simple terms as possible. And last, you're saying that, maybe not last, but you're saying that you've asked for an explanation of why your percentage of the bond is this, but you're paying this, and you haven't got that answer, right? And at least on the, have you asked, did you ask a while ago, or are we waiting for that answer? Or?
No, we just asked this last week for more information on that, because we received the 2016 valuation that has a list of retirees for us and for everybody else, and then also actives along with everybody else.
But there's no corresponding, right, and again, I'm not blaming anybody, I just want to be
That's
clear
fine.
on
I
this.
just want to point out that.
My next steps would be to ask them for a copy of the actual invoice that we get from Blue Cross Blue Shield for the individual souls.
Okay, so
Because
I'm-
there's no, I don't have any reconciliation at all on past employment benefits.
Got it.
And I'd like to be a better steward of that and
Sure.
understand it better.
Well, because, I mean, the way that it's out there right now, at least in the general theory of things, is you're paying more than you're paying for more than just your people. That's what it looks like on the theory. And there might be a million different answers for that, but
Yeah,
I'm just.
it could be, but again, I'm assuming that there's information I don't
Sure,
have.
that's what I
that,
just said. There might be a million different reasons
right,
for that,
right,
right? So I just wanted to get that across. And then, so you just asked. I was under the impression that maybe you asked a while ago and you're having trouble getting this
Oh,
information.
no, I'm
So-
sorry if I misled on that. This is new information to me. I'm learning it, and I'm learning that I need to ask more questions and get more information so that I'm better prepared on this, so.
Okay, that's fine. Thanks for now. I just wanted to make sure I understood everything right.
Okay, thank you. Commissioner Carabelli?
Thank you, Madam Chair. I didn't know you had just asked. I thought you had asked, and been waiting for an answer on that, because your numbers, if your numbers are correct, there's a problem there. And it may be why you're having some financial difficulties, and that could be the answer to all your problems instead of $4 million, okay? So I look at this, and creativity is the point of, if you're spending an average of $817,000 a year on building maintenance, and CDBG funds comes up where you qualify for, let's say they want to give you $400,000. Well, that's $900,000 less a year than you have to come to the county coffers to take out to, and you can use those federal funds. So my thing is that, you know, when I talk about consolidation of food services and talk about all this different stuff, I know I don't like to hear myself speak. I say it because things like this is, if we could work together in all these different departments and funds that we have, could help offset. It doesn't have to come out of the general fund. And my job is to protect that general fund for my residents and to ensure that it's being spent correctly. And to subsidize, and this isn't to you personally, a facility that they're not getting a personal benefit, the taxpayers from. And when I look at outside people inside of the facility that don't pay taxes in the county, I personally, nobody else, I personally struggle with that. And then to come back, and again, not your fault, you weren't here years ago when they were doing $10 million a year subsidies in this. So I have to go back at 10,000 feet and look down at this, not blaming you. But I get upset when you share the information, first time I'm hearing about it, not about any other board members, that there could have been a misformula, and maybe you've been overpaying, and that credit may be enough, and you ain't got to come back and ask for any money. So yes, I'm going to get creative as possible all day long and every day, and then when I get home tonight, to figure out how you don't have to take general fund dollars and use it to subsidize. So that's where I personally am coming from.
Thank you.
Thank you.
Thank you. Commissioner Brown?
Well, you did the right thing about coming here and letting us know about it, and that's positive. And I think anything you send the executive's office on this subject, we definitely need to be CC'd on it. Because there's a long history, and your organization's been a stepchild of the executive's office from day one. There was a power struggle over this board about who's going to run Martha T. Berry, and between the Board of Commissioners or the executive's office. And there's some animosity that you might be paying the freight on that, unjustifiably so. So we'll see what information we get back and take a look at that. But I suspect that's probably what's going on. So, but good job by Commissioner Carabelli. Look at those block grant hours. Who knows? It may be a way to save us some money. But, and he's right, because I was one of those who wanted to close that facility. I had to close it a long time ago. Thank God that they got the right people in place and they made the right decisions to turn it around. Otherwise, it'd have been gone long ago, because there's no way we could afford that. So let's take a look and see what's going on, and we'll evaluate it. But
We do have several months on
you're not
it.
at the red line yet, but we definitely don't want to start going back in that bad direction, because we can't sustain that. So, thank you.
Absolutely, Commissioner Brown, thank you.
Thank you.
I can't manage it the way it was before. I can't continue to cut. You know, we need to keep building in this way. And I appreciate having the conversation. Everybody here, many people here have it, as Commissioner Carabelli said, has a 10,000-foot view. I'm trying to get to the 5,000-foot view. You have a lot more history than I have, and I'm still trying to serve well and look at the long picture. Thank you for understanding and for your patience while we come through this difficult conversation. I'm really grateful.
Thank you. Commissioner Leonetti?
Thank you, Madam Chair. I don't know if you know the answer to this or if somebody else does, do we have any idea what the building is worth that you're in right now, what the value of the building is?
I don't know. It may have happened before, but, my instincts, because I've been in for a few years, says that the building itself doesn't have as much value as the beds, and the beds are worth about $5.5 million. And what I mean by beds is they can purchase those and take them someplace else, split them up and put a number of different programs together. The building itself is only good here, but if you're looking at putting a continuing care retirement community or kind of tacking on to that, it's not a prime location. If you use truth in advertising, you would say, overlooked by the 10-story county jail next to the morgue and across from a chemical plant, you can live the rest of your life. It's
I got you.
It's a wee bit of a challenge.
I got you. Next to the jail, too. There'll be a brand-new jail there, maybe, too, so,
It's true.
It's true. But these beds you're talking about, those have some, and I'm just thinking here, those have some resale value, is what you're saying, the equipment there?
Yes, they do. It's my responsibility to give the board all the information that they need to be able to make good decisions. And this commission needs to be aware that the beds do have value. I spoke to a broker out of Ohio a couple of weeks ago just to say, let's take a look at this, if we have to do this. And, the business model is to be able to buy those and distribute them to other people, resell them. And it's about $20,000 to $25,000, depending on the person you talk to, of what those beds are worth purchasing as a license so they can resell them. It's not feasible to solve the issues because then you have pension left here, you have...
You've explained that before.
Yeah.
I guess going along, the letter's asking for a loan. It's not a loan, it's something you want to pay back, I guess, so it is a loan. I guess we'll act like a creditor here, assuming some things. What guarantees do we have that you'll pay that back? I looked at your chart, and I understand that once the one drops off, you'll have money available then. But what other guarantees can you give us in a sense? And I know it's a tough question, but it's a fair question.
I can give you no guarantees, but I can tell you what the history is, and I can tell you what I see based on my experience. I also know that. I've been able to, with a good team, right the ship there financially. So, first quarter, I actually put in here that EBITDA was $300,000, but in actuality, that's my net, year to date. That specifically we had designed to help, manage some of the legacy debt, because that doesn't hit our books in the same way that allocated budgets do. So I needed to make sure that I was having money available for that. I also know that I can do that. This is a very large building, and the fact that it's a Class 3 right now, I have the ability to manage it in a way that helps long term. Now, we're also one of the 34 county facilities, there's only 5 that doesn't have a millage. And right now we can run that as well. So it's another idea that we might see if the voters would support us, but I don't know if that's the case.
Leon will handle that.
All right.
Not happening? Okay.
Okay. All right, thank you. Thank you, Madam Chair.
Thank you. Commissioner Kleinfeld on your second round.
Okay, I am going to go at this one more time again because I want to understand this. I think it's important. Commissioner Kraft and I have looked at this paragraph like 6 times and we're reading it a certain way. So I want him to explain it. Okay, so on the Martha T. letter, you have that in front of you?
I do not, I'm sorry.
You do not.
I'm hoping it's on the first page.
It's on the first page. Yes.
All right.
Okay, so the third paragraph down, it says, prior to Kevin's arrival, the county took out approximately $300 million in bonds to fund retiree health care and downtown renovations. They were 2 different things. The bonds for renovations were for renovations for downtown. The bonds for pension for OPEB were for OPEB. A portion of that was used to fund Martha T. Berry's OPEB. There is some evidence that discussion from Martha T. Berry included funding over several years, as it would help Martha T. Berry balance cash and reimbursement. It was decided to fund it all in 1 year. Fund what all in 1 year?
Fund the OPEB through the bond.
Okay. This decision gave Martha T. Berry a short-term influx of $9 million. And then it says, and a boost in the reimbursement rate, and then the next paragraph says the $9 million was used partially to begin paying OPEB, and it helped pay for badly needed repairs and improvements. I thought the $9 million, according to that paragraph, was your OPEB that was given up to you up front.
Oh, no. Thank you. It's important to note. The OPEB amount was paid, the bond was paid, and the money was put into the OPEB. I understand the question now, Commissioner. I'm sorry that I didn't understand that before.
That's the way it reads.
Yeah. What happened was the whole $20 million was put towards the OPEB liability for MTB.
Okay.
Now, what we were able to do, and this happened just
that
before we
gave
got
you
here.
a cash influx because you weren't paying that.
No, we paid it all, and we immediately began paying the $1.3 million, the debt against that bond. But what we do when we file our cost report, we sent this to the state of Michigan. We actually used Plant Moran to help us with it, and they said you can only, we wanted to put it over 10 years to help balance our cash flow, and they said you can only do it over 3 years. Because it was in 3 years, that expense of $20 million significantly was higher than what we got reimbursed for from our regular receipts. So just so you know, we have, okay, so we went from 22 million in receipts to 30 million in receipts. And CMS said, okay, as a county entity, we're going to give you 65 cents on the dollar back on that, essentially. So we got $9 million back over a year and a couple of months. And the intent of that CPE is to recognize that our costs sometimes are higher than, because we are a government entity, we tend to invest more, and they wanted to make sure that a portion of that was taken care of. So that was the short-term influx. That money came back to us in the form of a check from the Centers for Medicare and Medicaid Services after we filed our Medicare cost report and our Medicaid cost report. Yes, it is complex because normally you think if you just give them a bill, they send it back to you, but there's a huge formula that they work through.
But the $9 million, the reason you got that extra influx was tied to the paying extra an OPEB those 3 years?
Yes.
So it was tied to that, so you got that influx, and then it was used for repairs?
Partially. We started paying the OPEB back immediately, so it was about $5 million towards OPEB and about $4 million towards the repairs.
Which is the $4 million that if you had not spent on repairs would be covering these years that we're talking about. So that $9 million came back to you because of the extra money that went towards OPEB.
Mm-hmm.
And then instead of using that $9 million to cover these costs over these years, you used $4 million of it for repairs. So now you have a period of years that's pretty close to that $4 million that you can't cover because you spent that money that really should have been dedicated to OPEB, because that's why you got it.
I half agree with you.
Okay.
I half agree that
Thank
I spent the $5 million, but I disagree with you that I had to spend it all on OPEB, because when the money comes in for us, we have to use it for, we have to make decisions from an operational standpoint. The building had not been maintained since 2009 in a way and we had people in standing water in the kitchen. We had pipes collapsing. So I could not wait another 4 years to do that, Commissioner.
Right, and I don't disagree with that, but had we funded, had we not done it all up front and we had funded it over a period of years, you would not have had that $4 million to spend on needed repairs.
I would have had a better balance. Well, again, this happened before I got here.
Well, yeah, I'm not judging you.
But I'm saying,
just
yes, we would have had.
If it got spread over the years, you wouldn't have had that $4 million to spend on repairs, and OPEB would have been covered during this gap.
But I would have had more money over the time because we lost a lot of the additional reimbursement. You know, you notice in there that there's also a cut in our rate because
Okay.
we're done with that. If we continued on, we would have had our stronger rate, we would have had a better cash position because our rate would have been higher.
So that was a decision before you got here that was a bad decision.
I think it was best for the county, but it did hurt us, yes.
All right, thank you.
Do we have any more speakers? Okay, so we are.
Just one comment.
Okay.
Kevin, through all this turmoil, you've still done one hell of a job over there. Thank you.
Agreed, thank you. We appreciate you coming. So we are receiving and file. So do we need a vote? Yes, let's vote. Let's take correspondence as a whole. The vote passed 13-0. Okay. And our correspondence, can I have a motion to receive and file in its entirety? Commissioner Romano and Commissioner Leonetti? Do we need to vote? Let's vote. And it passes 13-0. Do any commissioners have new business? Commissioner Kleinfeld?
I just want to tell the board that we got our first bill from Yo and Yo, but it's not a detailed bill. It's just the original retainer that we had said we would do. They're just seeking it for the first time now. So that's the original $30,000 retainer. We'll be processing that for them to be paid. There is no detail involved in that. I don't know if there will be in future ones. Thank you.
Okay. Commissioner Carabelli?
Thank you, Madam Chair. I guess for staff, I do have a question. On area aging on 1B, there's a $58,000 for receiving file for a contract that we owe. Would that not be a budget amendment? Was this covered in the budget, or is this something that should be an actual action item and not put on a receiving file?
Well, it was sent to finance for signature. They haven't sent it to the board
So
for
it'll
approval
come.
to sign. So that's just our receive and file of it. When I talked to the staff person there, she said they had asked her to change it to have Mark Dalton's signature on it, and she sent it back, and she hasn't received it back yet.
So it should probably come for an action
Yes, it should
item.
be coming from finance. And then that money is appropriated in the budget, so there's a line item in your appropriations, but you're correct, it should come through with approval before they sign it.
Okay, thank you. Anyone else?
Me.
Chair Smith?
Thank you. Just a quick defense of our staff, because I was looking at the same thing a few of us were, that when you look at this and it's all cut off on the inside, what the problem was, and the problem is with our system, that there is actually a flag in for a repair of the system. When it comes in under publisher, it doesn't show it on the screen, it just prints it like this, and it needs to be converted into PDF, so there is a work order that's in process to fix all this. So in case anyone was thinking, like I was, that we were gonna string Mike up after this, we can
That was just you.
unlight the torches. Thanks. Anyway, all right. I have a motion? Oh, sorry.
Don't you dare. Anybody else have anything to share? No? All right. Public participation, 5 minutes max per speaker or longer at the discretion of the chair. That's me. Oh, we do have one.
I'm not sure that qualifies as public participation. The answer to the question was 200% of poverty, so that'd be just over $50,000 for a family of 4 for weatherization programs. Thank you.
Thank you. Appreciate that. I know, I'm sorry. Thank you, Mr. Cutler. And let's have a motion to adjourn. Mr. Drolet? And who's the other one? Okay, Kraft. Andre didn't want it today?
See you tomorrow.
Save, there we go.